You might find this surprising, but the very first signs of heart disease, diabetes, or hormone decline don't always show up in your chest or your lab work. For many men, they appear quietly, right where you least expect them, between your legs. Those small changes in your erections that you've been tempted to brush off, they are not random. They are your body's early warning light, and ignoring them can cost you years of intimacy, confidence, and even health. I know how heavy that feels because for decades I've sat across from men who carried that same silent fear. They laughed off the jokes, made excuses at home, and told themselves it was just age. But inside they were wondering, is this the end of who I used to be? Gentlemen, I want you to hear me clearly. You are not broken. You are not too old. And with the right knowledge, you can protect what matters most. My name is Dr. John E. Morley, and for more than 35 years, I've been helping men over 60 restore their health, protect their confidence, and age with dignity. In this video, I'll walk you through the 10 mistakes you must never make with your penis, habits that quietly destroy erections and chip away at vitality. And make sure you stay with me until the very end, because mistake number 6 is the one almost every man gets wrong. And fixing it could be the difference between decline and renewal. Before we dive in, make sure to hit the subscribe button and turn on the notification bell so you never miss another honest, science-based health insight designed specifically for men over 60. And if this message already resonates with you, type 1 in the comments. If it doesn't, type 0. Your feedback helps me make these videos even more helpful for you. Alright, let's get straight to it. Starting with the very first and most overlooked mistake, ignoring changes in your penis. Mistake 1, ignoring changes in your penis. The first mistake, and perhaps the most dangerous, is simply ignoring the changes. When morning wood becomes less frequent, when erections aren't as strong, or when arousal feels different, many men tell themselves it's just aging, stress, or being tired. They wait weeks, months, even years, hoping it will fix itself. Biologically, those changes are signals. Weakened erections often mean your blood vessels are narrowing or your nerves are losing sensitivity. That's not random. It's your circulatory and nervous systems asking for help. And remember, your penis is often the first place you'll notice problems because its blood vessels are smaller than those in your heart or brain. Emotionally, ignoring these changes slowly eats away at your confidence. You may avoid intimacy, make excuses, or quietly carry the fear that you're no longer enough. I've seen men withdraw from their marriages, not because they stopped loving their partners, but because they were afraid of disappointing them. Practically, the fix is simple but vital. Pay attention. Track changes in your erections. If something feels off for more than a few weeks, don't ignore it. Talk to your doctor. Catching issues early can prevent years of decline. Remember, you wouldn't ignore a warning light in your car. You shouldn't ignore one in your body either. Mistake 2, falling for dangerous home remedies. The second mistake I see far too often is men turning to dangerous home remedies out of desperation. I wish I didn't have to say this, but I've treated men who have injured themselves with everything from apple cider vinegar applications to homemade devices fashioned out of bottles and metal rings. Biologically, these so-called hacks can be disastrous. They may cause nerve damage, scar tissue, or even permanent erectile dysfunction. Once the delicate structures of the penis are injured, recovery is slow and sometimes incomplete. Emotionally, these remedies usually come from a place of fear and insecurity. Men convince themselves they're not enough, and that a quick trick will make them bigger, harder, or better. The truth is, most of them already have what they need. The problem is circulation and health, not size. Practically, the rule is simple. Stop experimenting with unproven tricks. Avoid jelqing, constriction devices, or anything you've seen in shady online forums. If you're considering any type of device, use only those that are medically designed and only after talking with a professional. Protect the body you have. It's far more resilient than you realize, but only if you treat it with respect. Mistake 3, neglecting hygiene. This one may seem basic, but you'd be surprised how often it's overlooked. Poor hygiene, especially for uncircumcised men, failing to gently retract the foreskin, clean underneath, and dry properly can allow bacteria, sweat, and dead skin cells to build up. Biologically, that buildup creates a breeding ground for infections and inflammation. Over time, it can even contribute to conditions like balanitis, chronic irritation, or, in rare but serious cases, cancer. Erections depend on healthy, pain-free tissue, and neglecting hygiene quietly undermines that foundation. Emotionally, poor hygiene often creates shame and avoidance. I've had patients tell me they avoided intimacy altogether because they were embarrassed about odor or discomfort. What starts as a small daily neglect can ripple into isolation and lost confidence. Practically, the fix is simple. Treat your penis the same way you treat your teeth. Small, consistent care prevents big problems later. Wash daily with warm water and a mild soap, rinse thoroughly, and make sure to dry gently. Avoid harsh scrubbing or strong fragrances. They irritate sensitive skin. Think of it as maintenance, not punishment. When you care for this part of your body with respect, you're not only protecting your health, you're protecting your dignity and comfort in moments that matter most. Mistake 4. Ignoring pain, bleeding, or lumps. Your penis should not hurt. Period. Yet too many men brush off warning signs. Pain during sex or urination, blood in the urine, an unexplained lump, or even an ulcer, as if they're just part of getting older. They are not. Biologically, these are red flags. Pain could indicate an infection or kidney stones. Blood might signal urinary tract issues or something more serious. Lumps or ulcers can sometimes point to cancer. Ignoring these signs is like ignoring smoke in your house. You don't wait to see if it turns into a fire. Emotionally, many men carry silent worry when symptoms appear. They don't talk about it, but the fear lingers in the back of their minds, adding stress and anxiety. Ironically, that stress only makes sexual performance worse. Practically, the solution is clear. If something feels wrong, speak up. Don't delay. In medicine, delay is the enemy. Early detection almost always means easier, more effective treatment. You are not being weak when you see a doctor. You are being wise. Remember, your health is the foundation of your confidence. Protecting it is not just about surviving longer. It's about living better, with freedom and peace of mind. Mistake 5. Losing control. During sex. This one might surprise you, but it's real, and it's more common than most men realize. Penile fractures. Yes, they exist, and they are surgical emergencies. Biologically, here's what happens. When an erect penis bends suddenly and forcefully, often during vigorous or uncontrolled intercourse, the outer tissue, called the tunica albuginea, can rupture. The moment it happens, most men hear a pop or feel a sharp pain, followed by rapid swelling and bruising. Emotionally, this kind of injury leaves a scar that goes far beyond the body. Even after surgical repair, the memory of that moment can destroy confidence and create anxiety every time intimacy begins again. Practically, the prevention is simple. Stay present, not frantic. Use lubrication generously to reduce friction and strain. Choose positions that allow control and comfort rather than risky angles. Remember, intimacy is not about speed or proving something. It's about connection. I once had a patient who told me, "Doc, I thought it only happened in movies." But after one careless moment, he spent months recovering and years rebuilding confidence. Learn from his mistake. Protect your body. Protect your peace of mind. Mistake 6. Overheating your testicles. There's a reason your testicles hang outside your body. They need to stay slightly cooler than your core temperature to produce healthy sperm and testosterone. Yet many men unknowingly sabotage this natural design by exposing themselves to too much heat. Biologically, frequent use of hot tubs and saunas, resting a laptop directly on your lap, or even carrying your phone in your front pocket can raise scrotal temperature. Over time, that heat can lower sperm quality, reduce testosterone levels, and quietly drain your vitality. Emotionally, low testosterone brings more than just bedroom problems. It can mean fatigue, irritability, and a gradual loss of desire, symptoms that make men feel less like themselves. I've seen men mistake these changes for depression, when in fact, their hormones were simply being suppressed by lifestyle habits. Practically, the solution is straightforward. Protect the environment your body was designed for. Limit prolonged heat exposure. Use a desk for your laptop, not your lap. Keep your phone in a bag or jacket pocket. If you enjoy saunas, keep the sessions short and give your body time to cool down afterward. Your testicles are the powerhouse of your male hormones. Treat them with care, and they'll keep fueling your energy, your confidence, and your performance well into later life. Mistake 7. Being too aggressive with masturbation. This is more common than most men admit, but it's one of the hidden causes of frustration later in life. I'm talking about overly aggressive masturbation. Biologically, gripping too tightly or relying on intense, unnatural pressure can desensitize the nerves of your penis. Over time, your brain becomes conditioned to respond only to that one kind of stimulation. Doctors even have a name for it: death grip syndrome. The result is difficulty achieving or maintaining erections with a partner, even if your body is otherwise healthy. Emotionally, this can be devastating. Men often blame themselves or feel embarrassed when they can't respond during intimacy, even though the real issue is conditioning, not masculinity. It creates frustration, avoidance, and distance in relationships. Practically, the fix is simple, but requires patience. Slow down. Use lubrication to reduce friction. Explore different rhythms, pressures, and sensations. Teach your body to enjoy variety, not just one rigid method. With consistency, sensitivity can improve, and your brain can relearn how to respond naturally. I once had a patient in his early 60s who told me, "Doc, I thought I was broken." But after retraining his body with gentler habits, he rediscovered confidence with his partner. His body wasn't broken, it just needed a reset. Mistake 8. Smoking and ignoring your overall health. Of all the habits that quietly destroy erections, smoking is one of the fastest and most damaging. Every cigarette you light sends toxins coursing through your blood vessels, injuring the very pipes that deliver an erection. The result? Narrowed, stiffened arteries that can no longer carry enough blood where it needs to go. Biologically, smoking doesn't just affect erections. It increases your risk of bladder cancer, heart disease, and stroke. Many men think it's just a habit, but in reality, it's stealing your vitality day by day. Emotionally, losing your erections to smoking feels like a betrayal. I've sat with men who said, "Doc, I never thought a cigarette could take this from me." The regret is heavy, especially when they realize it wasn't inevitable. It was preventable. Practically, the fix is clear: quit. If you can't do it alone, get help. At the same time, build a healthier foundation with exercise, balanced nutrition, limited alcohol, and stress management. Erections are not separate from your health. They are the reward for good health. Every step you take toward protecting your circulation, whether that's putting out the cigarette, going for a walk, or eating better, is a step toward reclaiming your confidence, your intimacy, and your future. Mistake 9. Beating yourself up. This mistake is one I see in my clinic almost every week. Men tie so much of their identity and self-worth to sexual performance that when something doesn't go right, they turn the blame inward. They beat themselves up. Biologically, here's the problem. Stress hormones like cortisol are released when you're anxious, ashamed, or frustrated. Cortisol directly interferes with arousal and blood flow. In other words, the more you criticize yourself, the harder it becomes for your body to respond. It's like trying to drive with the parking brake on. Emotionally, this creates a vicious cycle. One imperfect night leads to self-doubt. Self-doubt leads to anxiety. Anxiety leads to avoidance. Before long, men withdraw from intimacy altogether, not because they don't want it, but because they're afraid of failing. Practically, the fix is compassion. Be kind to yourself. Understand that every man has off days, just like every athlete has bad games. Talk to someone you trust. Reframe setbacks as signals, not verdicts. When you release the pressure to be perfect, your body relaxes and performance improves naturally. I often remind my patients, you are not defined by one night. You're defined by how you care for yourself, your partner, and your health in the long run. Mistake 10. Not using it. The last mistake is simple, but powerful. Not using it. There's a saying in medicine, use it or lose it. And when it comes to erections, that's absolutely true. Biologically, erections are not just for intimacy. They keep blood flowing through the penile tissue, maintain elasticity, and preserve nerve sensitivity. Without regular erections, whether through intimacy or gentle solo stimulation, scar tissue can develop, shrinkage can occur, and responsiveness declines. Emotionally, avoiding intimacy sends the wrong message to yourself and your partner. Over time, it can create distance, frustration, and the belief that connection no longer matters. But the truth is, intimacy isn't just about sex. It's about confidence, affection, and staying engaged with life. Practically, the fix is simple. Stay active in whatever way works for you. That could mean intimacy with your partner, or solo stimulation to maintain function. Even light arousal, once or twice a week, helps keep the system alive. Think of it like exercising a muscle. You don't have to push it to the extreme, but you do have to use it to keep it strong. Your erections are part of your overall health. Protect them with care, and they'll reward you with strength, connection, and dignity well into your later years. Conclusion. We began today with a simple but powerful idea. The health of your penis is not separate from the health of your body. It is your health. Those quiet changes you've been tempted to ignore are not random, they're signals. And by paying attention, you can protect not just your erections, but your confidence, your relationships, and even your longevity. Let's recap the 10 mistakes you should never make. 1. Ignoring changes. Weakening erections are an early warning sign, not just aging. 2. Falling for dangerous home remedies. Quick fixes can cause lasting harm. 3. Neglecting hygiene. Small daily care prevents infections and long-term damage. 4. Ignoring pain, bleeding, or lumps. These are red flags, not normal changes. 5. Losing control during sex. Stay present, use lubrication, and avoid risky positions. 6. Overheating your testicles. Protect them from heat to maintain testosterone and sperm health. 7. Being too aggressive with masturbation. Gentle variety keeps nerves sensitive. 8. Smoking and neglecting health. Erections are the reward of good circulation. 9. Beating yourself up. Stress and shame only worsen the problem. 10. Not using it. Erections are like muscles. Use them to keep them alive. Taken together, these mistakes reveal an important truth. Your erections are not just about intimacy. They're about circulation, hormones, nerves, and mindset. When you care for these systems, you're not only protecting performance, you're protecting your heart, your brain, and your future. So here's my challenge to you. Starting today, commit to respecting your body. Pay attention to changes. Ditch the dangerous tricks. Treat your health as the foundation of your confidence. Because it is. Imagine this. 30 days from now, you've taken small but consistent steps. Walking more, sleeping better, practicing good hygiene, quitting the habits that hurt you. You wake up and realize your mornings feel different, stronger, more alive. And with that change comes not just confidence in the bedroom, but confidence in every part of your life. Gentlemen, you deserve that. You deserve clarity instead of confusion. You deserve connection instead of silence. You deserve confidence instead of doubt, and it starts with honoring the body you've been given. So if this message resonated with you, do 2 things right now. First, hit the subscribe button and turn on the notification bell so you never miss another science-based men's health insight designed for men over 60. Second, share this video with a brother, a friend, or anyone you know who might be quietly struggling. You never know whose life you could change by breaking the silence. Remember this. Aging is not the end of vitality. Small choices today, protecting your health, respecting your body, using it wisely, can give you strength, freedom, and dignity tomorrow. I'm Dr. Johnny Morley, and I want you to hear me clearly. You are not broken, you are not too old, and you are absolutely capable of renewal. Stay strong, stay hopeful, and I'll see you in the next video.